Hello, I'm Sham. I'm a person with lived experience of kidney disease, and I'm the co-chair of BEAT-CKD CRE Pact. And for the pact, we have 10 members with lived experience of kidney disease from different stages of the kidney disease, and also age and gender, and also from different geographic regions. We meet bi-monthly and provide strategic advice on training methodology, curriculum, and materials. For example, we provide a lot of input on the development of the online training module impact, and also we work with researchers to establish some research priorities. We work closely with the communication and implementation team at BEAT-CKD CRE Pact, and one of the key items that came out of the team is around Kidney Bites, which is a consumer-specific friendly webinar, and we discuss topics along medication management, working with allied health professionals, and our mental health. Hello, I'm Sham. I'm a person with lived experience of kidney disease, and I'm the co-chair of BEAT-CKD CRE Pact. And for the pact, we have 10 members with lived experience of kidney disease from different stages of the kidney disease, and also age and gender. And
Hello, everyone. My name is Ashton Klein, and I'm here to share my experience with Kidney Bites, both as an attendee and as a host. If you're living with kidney disease or caring for someone who is, I highly encourage you to join this online community. I've previously attended a number of Kidney Bites sessions. One in particular that stood out for me was on the impact of CKD on employment. This particularly stood out as a carer and as having watched my brother struggle with the balance between managing chronic kidney disease and employment over the last 25 years. The atmosphere is so inclusive. It truly feels like a safe space to share our stories, ask questions, and to learn about research, and most importantly, to learn from each other. What stood out for me was how interactive these sessions are. We share tips and resources, plus the variety of backgrounds and experiences within the group means that there's always something new to learn. Whether you're curious about the latest research or looking for advice on everyday challenges, there's something for everyone. Fast forward to October in this year, and I had the opportunity to host a Kidney Bites meeting myself. I presented a session on transforming kidney care from a carer's perspective, something that as both a registered nurse and a carer of 25 years is so close to my heart. I shared my own personal story as a carer, facilitated conversations, and made sure that everyone had the opportunity to contribute. I encourage anyone impacted by kidney disease, whether it be patient or caregiver, to join us in the next Kidney Bites session. So mark your calendars for the last week of each month. Grab a coffee, tea, or your drink of choice, get comfy, and join us on Zoom. Thank you for listening, and I hope to see you at the next Kidney Bites meeting in November. Thank you.
My name is Natalie Brown, and I've had my transplant for 30 years donated from my wonderful brother. I live in Dunedin in the beautiful south of the South Island, New Zealand. I am involved with a lot of consumer advisory panels and boards and have a passion to improve life for people living with CKD. Today, I am here to share with you some of the updates from BEAT-CKD. It all began back in August 2022 when I came across an ad for consumer advisors to participate in the AKTM MFIT trial into the research of the benefits of exercise for dialysis patients, something I have been keen to introduce to the dialysis patients in my area, so it felt like a natural fit. I'm interested in any research that will improve the lives of those involved in CKD, being patient, caregiver, or family member. Once involved in the AKTN network, I was given the opportunity to become a member of the AKTN Consumer Board, which I now co-chair, and then a member of the NStarter Consumer Panel. I attend monthly research meetings where researchers get to present their current projects and have a chance to give feedback. In these roles, I get a chance to make a difference as to what research is undertaken, how it is undertaken, and what considerations need to be put in place from the consumer's perspective.
I'm Alan Blackley, residing in New Zealand, diagnosed with PKD in '96 after 4 hospitalisations with kidney stones. And my GP, when I returned home after the last bout, just advised me that PKD I'd have to take some pills and look after my blood pressure, and that I should be able to live to 84. And that was all I knew about it until the years went on, and things started to evolve into the later stages of kidney health. In about 2016, I became involved with the Southland Kidney Society, which is a local group of people suffering from kidney diseases, and I became involved there networking. I was then invited by Kidney Health New Zealand in 2020 to become a consumer, in which case I took the opportunity to be able to help out with others, and I started to find out more about PKD. KTN then invited me to come on board the metformin trial, which I was more than pleased to do. By this stage, I'd had my transplant, so this was a way to pay back what had been done for me. Been involved with, as I say, the PKD trial. Also was to have taken part in the phosphate, but having had the transplant, I was taken off it. I did the best fluids trial by agreeing to it as I was going in for my transplant. One of the ways I feel I've helped is in the presentation of material. When I was first asked to look at some of the participants' information, I found that it was very long and very wordy, and a lot of people would not read through it, and therefore would throw it out. But since then, we have had changes made to the presentation of requests for taking part in trials. This, I feel, has brought on more people, because one stage I saw that very few people below having a diploma were taking part in the trials, and this could have been because of the way it was written. But making it more simpler has been a very good achievement from what I've seen so far, and hopefully this will bring on more people.
Hello everyone, my name is BEAT-CKD. I'm happy to be here to talk about what I've been doing throughout the past year in this network that we all share in common. For the past year, I've been a part of the Centre for Kidney Research, in which I've recently completed a paper on the mental health of children and their caregivers living with kidney disease. This paper was made possible through the partnership with my colleagues, who each share the common goal of improving the lives of those living with kidney disease. Earlier this year, I also had the opportunity to attend the ANZ conference in South Australia. During this conference, I represented ANZ Data, BEAT-CKD, and the Centre for Kidney Research on the consumer panel. We spoke about patient engagement and what we do within the field of research and translation, as well as how others can get involved. At this conference, I also presented a poster both independently and alongside ANZ Data staff and the Consumer Advisory Panel Chair, showcasing our collective efforts to improve patient care. In addition to my research role, I'm also co-chair of the ANZ Data Consumer Advisory Panel. In this position, I value partnership as a cornerstone of our efforts. Working in partnership with patients, families, and fellow panel members, I aim to ensure that the patient's voice is central to research. By aligning our shared goals, we're not just working in isolation. We're pooling our resources to tackle challenges that affect us all. It's through these partnerships that we can make meaningful strides in enhancing the quality of care. Whether it's through research, advocacy, or clinical efforts, it's the partnerships that we build that enable us to tackle not only the medical aspect of living with kidney disease, but the emotional and social aspects. By continuing to foster these partnerships, I'm confident we can drive meaningful change and improve the lives of those living with kidney disease. Thank you.
Hello everyone, my name is Karen, and I would really like to share a little about myself and my involvement with the impact modules. I've had kidney disease for many years as a result of lupus as a teenager. Over the years, I've experienced various treatments for kidney failure. I've had a kidney transplant, peritoneal dialysis, and now I'm on home hemodialysis, which I've been on for 14 years. I've always had the mindset that I want to be part of my treatment journey, to be a collaborative partner. And you may ask, how could you or I, as people with kidney disease or as carers, be of use to researchers? Well, this is something about which I'm extremely passionate. Research is expensive and time-consuming, sometimes taking many years to finish. So it's important that the research is targeted at what will help those with kidney disease, which is us. Times have changed. No longer are we simply passive recipients of treatment. The researchers need us to help improve research focus and outcomes that will improve the treatment and quality of life of us and others around the world. I often reflect to my time as a transplant recipient, to when I was on peritoneal dialysis and now on hemo. These treatments are life-saving and incomparable to the treatments of a few decades ago. However, they still aren't perfect. The researchers need us to help improve all aspects of treatment. And this might seem very daunting, particularly if we've had nothing to do with research. We may not have higher education. How can we help? Enter the impact modules. These are a series of short online training sessions which are designed for people with CKD, carers and family, known as consumers, who would like to participate in the research process. These modules can be completed quickly in the privacy of our homes at no cost. To complete the modules is really not a huge time commitment. And I was honoured to be asked to help review the first module and a subsequent survey. It was an amazing experience which made me feel empowered in my kidney journey. The first module explained the importance and benefits of our involvement. You may think that it might be a bit dry. Not at all. The module I reviewed was interesting and engaging and comprised short videos, text, and the spoken word, and took just a few minutes to complete. But most importantly, this module lays the groundwork for understanding how patients can actively participate in research initiatives and provides people with experience of CKD with the knowledge and confidence to contribute to all stages of research. And additionally, I helped to create a survey which accompanies the modules. This survey aims to gather feedback from those who view the modules to ensure that the content is impactful and meets the needs of our kidney community. Please keep an eye on the BEAT-CKD website for the modules launch in just the next few months. Thank you.
If you'd like more information on how to become involved, please see the links below.
Whether you're a patient, a caregiver, or simply someone interested in improving health research, you are important to researchers because of your lived experience with kidney disease.